Good Thursday morning, everyone. I'm Dr. David Wild, Vice President of Performance Improvement, filling in for Dr. Steve Stites here this morning, our Chief Medical Officer. We are coming to you live from the Dolph Simons Family Broadcast Studio. Today, we'll talk a bit about how the University of Kansas Medical Center is helping to lead the nation in improving how we respond to the COVID-19 challenge in our skilled nursing facilities and other long-term care facilities. There's a deadline looming in that story, and we'll get into that and introduce our guests shortly. But first, a big welcome to Dr. Wissam El-Altrouni today, one of our infectious disease physicians and partners with Dr. Hawkinson. He's filling in for Dr. Hawkinson today. Wissam, would you tell us how we did with our numbers overnight?
Yes, it actually hurts to look at those numbers today. We have the highest number we've had, 51 inpatient confirmed cases, 18 in the ICU and 10 on the ventilators. We have about 28 recovered. And in Hayes, there are 21 total, 19 active and 2 recovering.
Yeah, those numbers definitely are not what we were hoping for, although maybe in many ways what we saw likely to happen this week. Yeah. I think that 51 is definitely our highest number of acute inpatients here at any one time. Really since the beginning of March, and our ICU sort of complement has stayed stable over the past few weeks, which is fairly good. Nonetheless, there are definitely people in the hospital needing care related to their COVID disease. So before we jump too much into our long-term care and skilled nursing facility discussion, Jessica's here for Jill today. Jess, any reporter questions out there?
Hi, good morning. No, not yet. If we get in any, I will let you know.
Excellent. All right. Well, let's get on to our conversation then. We have 2 guests with us this morning. Dr. Shauna Wright, a licensed psychologist and the principal investigator for the KU Med Center site of the Nursing Home Echo Project. We'll talk much more about what that means in just a minute. And also joining us is Dr. Jessica Callender-Rich. She's a geriatrician here on our medical staff and an expert that we lean on regularly in this space. She's also a national member of the Coronavirus Commission for Safety and Quality. So, good morning to you both. Thanks for joining us.
Morning.
Shauna, let's start with you. Can you explain to us a little bit about what the ECHO project is, and then a little bit about how grant funding earlier in the pandemic from the CARES Act is helping your team help the state of Kansas?
Thank you. Good morning, and thank you for having us. So we'd like you to think of ECHO as a training model where we use a video call, much the way I'm connecting with you today, to connect COVID-19 experts and skilled nursing experts with nursing home staff right in their nursing homes. So the staff get the most up-to-date COVID information and training from experts right where they work. And one of the great things about the grant that we received is that we've been able to pull together specialty teams that include great professionals like Dr. Callender-Rich to provide this training to nursing homes throughout the state of Kansas for free. And most of the nursing homes will qualify for a $6,000 incentive for joining and learning and improving care in their nursing homes. So it's a great opportunity.
Definitely sounds like it is, and it's a great chance for us to share our experts here on our campus and in our community with the rest of the state. Before we go too far, would you mind telling us a little bit about what ECHO stands for in the Project ECHO?
You bet. ECHO stands for the Extension of Community Healthcare Outcomes. And the idea is we take the knowledge from the experts and we directly deliver it to our working force on the ground, our nurses, our doctors that are treating and caring for residents in nursing homes. And then they can take that knowledge and share it with all of their patients and residents. So it's a way to really increase their knowledge through extending the knowledge of our experts.
And it's impressive, I think, that we're using technology to really help improve outcomes. So focusing on this as a form of outcomes research, correct?
Absolutely. What we're hoping to see is not only do we deliver this education into the nursing homes and support them and mentor them through the process, but then we're also looking to see that quality improvement across the board in nursing homes because they've been able to learn from each other and learn from the experts.
Dr. Calendar-Rich, you're one of those experts on a specialty team. Tell us about what that means.
I think it means a lot of things, but more than that, we are in a situation where nursing facilities are really seeking information. They've been thrown all of this regulatory space and lists of things they need to do. They're getting a lot of pressure from the community, and frankly, they don't always know how to put everything into play. And so this program, really, as we look through all of the different pieces that are going to be presented and have been presented in the first session, focuses in on how to implement on the ground the stuff that they are now required to do, how to take those regulations and turn them into practice. And they're doing that with groups of people from a home state. So it's a national program, but each state has its own representatives, those that received the grant, of course. And so the people that sign up for this program will have experts from Kansas that will be familiar with the Kansas regulations and how to apply them.
I think that's an important part of the conversation, that this is not someone coming in, swooping in, if you will, and telling you what you must do, but instead people from your home state, experts from your home state, really helping you understand how it can be done to improve the things that are important to the residents in those facilities and communities across the state. So thank you both for that. Before we get too much more involved in deadlines and things for this program, maybe let's just take a minute and talk from both of your perspectives about why the long-term care facility conversation and improving COVID care in long-term care facilities is so important to our communities and our state. Shauna?
Great. Well, we know, sadly, that more than a quarter of our COVID-19 related deaths are happening in nursing homes. So we know that this population is vulnerable for several reasons, because of complicated healthcare issues, because of frailty, because of age. So we want to make sure that we're reaching the care providers that treat this population. And we also know that it's hard to keep that workforce going. They've taken a lot of pressure, a lot of stress on their shoulders. So it's important that we get in there, not only to train them, but to support them and make sure that they know that they have support and guidance in the work that they're doing. It's our most at-risk population, and it's our workforce that needs the most support right now.
Dr. Calendar-Rich, I know you see patients in the hospital setting and in long-term care facilities and skilled nursing facilities. That probably means you have a bit of a unique perspective. What's your take on the impact of this in long-term care facilities across our state?
Yeah, we have seen through part of my work, I'm actually going into facilities that have outbreaks both in our region and working with some folks across the state to do the same thing, to help stand up and support really putting these infection control and really good practices into play in the right way at the right time, but more than that, in whatever way will actually work in that facility. And something like this program really helps to provide that guidance and frankly provide some consistency across the board, because what's happening is we're getting all of these regulations and rules sent out by different bodies, and this has been happening, of course, I think across the board in healthcare since March, but it is paired in the nursing facilities with regulatory visits and surveys from the state, and often some penalties. And if we can help support the facilities to implement the right rules, then we can move forward with everyone providing the best care possible.
Dr. Al-Altruni, as you've seen patients in the hospital here who have come from long-term care facilities, we're all aware that those that are older and those with chronic disease are more likely to have severe implications from a COVID infection. But tell us from your perspective how the specific population, long-term care facility residents, how they impact our hospital, the number of patients that we see, and then any maybe distinctions from your perspective on why better managing these patients in their facilities and better managing the infection prevention practices can help with the impact of hospitalizations.
Yeah, as you mentioned, that these are elderly with comorbidities and at increased risk of severe disease, including longer hospitalization. If you talk about healthcare resources and usage of beds, duration of hospitalization and complication is going to be much higher in those patients. At the beginning, again, we've seen outbreaks in different facilities, and this will definitely impact how much we're seeing in the hospital. As far as infection prevention, if these patients are prevented from getting infected in those healthcare facilities, obviously, I've spoken with Dr. Calendar-Rich before about how in those nursing facilities they have separate wards where people who are not that sick can be separated from the rest of the patient and have dedicated staff that will prevent transmission in the healthcare in these long-term nursing facilities.
I think that's an important point for all of us, because we talk often about right care, right place, right time, and if we're able to prevent these infections and also manage patients to be in the hospital for an appropriate period of time, but also be able to receive convalescent or recovery care outside the hospital, we might benefit. Dr. Calendar-Rich?
I think I do want to take a moment to say that these facilities are really doing the best they can. I don't want us to sound like there is going to be any blame placed. This is all about supporting them in a really hard time. And infection control has always been a part of the regulatory process in the facilities, and they are really doing their best to ramp up with little bits of support and little bits of resources. And I just want to take a moment to thank all of them for everything that they're doing and trying to do.
It's a great point. There's a lot of commentary recently about the challenge even that the administrators in these facilities really face to help manage the population and employees and to do that safely with the resources they have. And I think you're right. There's no blame being placed here, none whatsoever. I think we all recognize that everyone comes to work trying to do the best they can with the resources they have, and adding resources in the sense of experts and consultation and education is a great way to support them. So, Shauna, I mentioned at the onset that there's a deadline looming. Do you want to tell us a little bit about that and why it's important?
You bet. So I'll start by saying, if you have a loved one who lives or is placed at a nursing home or who works in a nursing home or a skilled nursing facility, find out if they've joined the ECHO. And if they haven't, please ask them to sign up today. So we started and launched our first two groups yesterday. They went marvelously. We have one more group starting Tuesday. And we need nursing homes to sign up really by 5 o'clock on Friday, because our group sessions are filling. And so we'd like to hear from you by 5 o'clock on Friday and fill up all of our groups. And if you need to have a Wednesday training slot and you missed yesterday, we have a way for you to make it up and join in with that group, and we'll get you going.
Great. I know we showed the number on the screen and the way that people can register. Individual facilities, correct, would call and register via that number. We need the administrator to register first, so they can call the number here. You could also Google KUNC Project ECHO, and then there's a web link that you can use to register as well. Great. One of the other important points, I think, as we talk about long-term care facilities, and I know, Dr. Calendar-Rich, as you're out there and seeing patients and working with these places, we hear a lot about individual outbreaks or clusters or locations where maybe all of the residents in a facility have become positive. But as you were saying, that's not because people aren't doing the right things, correct? I mean, those places are examples, but that's not what we're seeing in every facility across the state. And there are things that we can do to support facilities who find themselves with positive patients in their care as well.
Absolutely. So, just using the basic tenets of infection control has been shown not necessarily to prevent cases from coming in or even to prevent a small outbreak, but we know that we can do the best infection control practice, right, with cohorting and hand hygiene and using the right PPE now that it's more available from our county and state partners, and really just focusing in on those key tenets of infection prevention. That has really helped keep most of these outbreaks small. I will say that there are many more popping up, and we have really good data out there to show that as community numbers rise across the nation, we can follow the pop-ups of outbreaks actually to identify where the nursing home outbreaks are going to start spiking. And unfortunately, as our numbers in this area have risen, so too have the number of outbreaks in each of those areas.
Yeah, that's definitely true. As we see the population outside of long-term care facilities start to be infected more, we know that it's likely we'll see infections inside the facilities. That's been an important lesson, I think, that at times it's clear that the entry point, if you will, of COVID-19 into a facility is an employee that comes in from the community. And then these things that you're describing to prevent the spread become that much more important.
Yeah, and that's why it's so important for each of us to really take this individual responsibility to do the right things, both in the facility and outside the facility, really to make sure that we are physically distancing, masking, and staying within our home bubble whenever possible out in the community so that we don't act as the person who brings something into a facility.
Shauna, on a little bit of a different note, you mentioned at the beginning of your comments that we use in Project ECHO technology, much like this call, to be able to bring our experts into the local facility as a resource or into this cohort. One of the things that we hear from some of our rural communities in our other work is that technology or internet access even at times can be a challenge. Is that a barrier for this project? And if so, how do you plan to address it?
It could be. To this point, all of the nursing homes who have registered do have appropriate broadband and bandwidth to connect with us. So we're using the Zoom platform and technology, which is really more cloud-based. Most nursing homes have some internet access, so we're not taking a huge toll on their broadband with the platform that we've chosen. We have not run into any nursing homes or come across any that have registered who've identified broadband as an issue. However, I can tell you we have a fabulous IT support staff, and if a nursing home were to contact us and let us know that they had broadband issues and still wanted to join, then we'd put a team on it and we would figure out how to overcome that, because every nursing home deserves to have access to this education. I wish I could tell you exactly what that would be. That's not my specialty, but we would find a workaround because we are very passionate about this project and believe everyone should have access.
Excellent. So I know, Dr. Calendar-Rich, you have to move on to other obligations right at 8:30. I thought maybe we'll jump into some community questions because I imagine that we have some that it would be helpful for you to comment on. Jess?
Yes. So Anne asked, how has staffing in long-term care facilities been covered with staff illness and COVID-19? Where do the trained patient care assistants come from, especially in rural areas? Is there a state pool? Has CARES money gone to extra staff?
So a lot of questions there. Dr. Calendar-Rich, I know you've been out and about and probably are the closest to those questions and answers. Do you want to give it a shot?
Yeah, staffing, I think, across all healthcare settings has been a challenge, but definitely in long-term care and skilled nursing, even, in urban areas and in rural areas, there have been some rule changes that will allow CNA and certified nursing assistants to be trained much more quickly to help with staffing in these buildings. And there have been some alternative staffing models that have been set up to try to overcome the issues. In addition, there has been actually an increase in availability of agency staffing. So usually most facilities try to avoid using any agency staffing whenever possible. But what we have found is that some of our agency company partners have been able to provide staffing when there have been shortages across different areas of the state and region.
On the front of having a pool of available resources to share across a community or even the state, I think we know, as Dr. Callender mentioned, that staffing has been an issue, or at least a source of tension in a number of healthcare settings, including some hospitals in the metropolitan area here, and that COVID-positive employees just add to that tension. To the best of my knowledge, there is no statewide resource to be able to provide a significant number of nurses or CNAs or really any other clinical staff.
I also am not aware of such a pool. That said, when a facility is really in the direst of straits, I know that they have had to call in like National Guard type folks. That is something everyone's trying to avoid at every pass, of course, but there is a backup plan in place if that situation were to occur.
Jessica?
Yes, Susan says she lives in Lawrence. How would I find out if our local facilities have received the information from ECHO to participate, or if they are already participating?
Shauna?
The best answer is to ask them. It's fine to give them a call, ask them, are you a part of the ECHO? I will tell you our teams worked very closely with all of the nursing home associations in the state to get the word out. And we've had a national outreach on this project and a statewide blast about this project. But if there's a nursing home that you want to know if they're involved, give them a call and ask them. And we're happy to connect with them.
Great.
Another one for Dr. Callender Rich. Chris says, how should we handle seeing our seniors and elderly for the holidays? What are your suggestions? I miss them, and I know they need to be around family right now.
I think this is something that we are all really struggling with. So first I'll answer specifically for those in facilities, and then I'm going to answer for people out in the community. When it comes to facilities, the opportunity for visits, I think, as the numbers and percent positivity go up in our counties and state, those opportunities for visitation are decreasing because CMS has stated that if there's a higher than 10% positivity rate in any given county, no indoor visits can occur. And it's going to be probably way too cold to do anything outside. So from that standpoint, we're actually trying to figure out, both on a local, state, and national level, how we can work through things like taking someone's loved one home for Thanksgiving dinner. And if that's even a possibility, I would say that if a facility is able to allow that to happen, I can almost guarantee that they will quarantine that person when they come back and put them on isolation for a couple weeks. And probably that's the right thing to do because we really need to protect the other residents and patients in the building. From the standpoint of those older adults living at home or in the community, I think it all comes down to the same things that we always talk about, right? Balancing the risks and benefits here, doing everything we can to protect our vulnerable populations, and probably very much limiting those even small family gatherings, because we know that they have been shown to be spreaders sites of COVID-19. So I think that it's going to look different, right? I've heard people talking about dropping off their food for their loved one and then eating with them via Zoom or some other platform. Or even if it's nice, which, gosh, I hope it is. Sometimes it is. Perhaps having that activity take place outdoors with a fire pit in the middle or something creative. But really just making sure that we don't take what should be a joyous holiday and turn it into a catastrophic event.
Project ECHO, this is from Sarah. Project ECHO sounds like such a great resource for LTC facilities. What are your thoughts? Any chance a program like this could be set up for school reopening advice or recommendations?
So Shauna, as our Project ECHO expert, I know you're the PI for this specific outreach effort, but we've used this platform, the same concept, in other ways. And I think there's a possibility that something could work for schools like this, correct?
You bet. It's a great mechanism for getting training out and delivering it right where it needs to be. So when ECHO started in Albuquerque at the University of New Mexico, the very first ECHO was designed to help improve treatment of hepatitis C throughout the state of New Mexico. Since then, it's grown to many, many topic areas. All that we would need to make this happen for a scenario like you just described is to get our teams together, make sure that we have an audience and a learning group that wants to have that information, and then we build it. It's very, very efficient in getting training out there. So absolutely, there's potential there.
Okay, totally changing topics. Okay, can the doctors tell us if they've heard about the new mutation of the novel coronavirus in Denmark from minks?
Yes, so I saw the news about the outbreak in minks in Denmark, and they're culling animals there. There is monitoring going on for any mutations that are happening in the virus, and coronaviruses are known to be promiscuous, if you want. They infect several mammals, not only humans. We know they started in bats, and there have been documented infection in pets, including cats and dogs. We still don't know about transmission from pets to humans, but we do know that animals do get sick with this novel coronavirus. So we still need to find out if this mutation changes anything, or does it affect transmission to humans, or the pathogenicity of the virus. Is it going to make people sicker or not? So far, we don't know that. I know they probably in Denmark, out of extent of caution, are culling animals, which I think is reasonable in this setting. But I wouldn't jump to the conclusion that the virus is getting more pathogenic or worse, or that there is confirmed animal-to-human transmission yet.
Susan wants to know, what's a reasonable timeline or path to not just getting a vaccine, but getting it to enough people that it feels like there's an end in sight?
So there are a lot of questions and really unknowns that need to be answered to give you a reasonable timeline. I think what we know at this point is that the Pfizer vaccine is likely, that candidate is likely to be the first to submit for an EUA, and that we hear that will be happening ideally in the next week or two. There'll then be an approval process for the EUA to decide, based on the data submitted, if there's the thresholds for vaccine approval are met. And then we would start to understand a bit about logistics. Now, I think the challenging part is each of the different vaccine candidates that are out there, and there are probably 4 of the 6 that are likely to proceed to EUA fairly quickly, or at least EUA submission fairly quickly, have different logistical requirements for transport, for storage, for reconstitution, and potentially even around dosing if a booster dose is necessary for all of them. And so until we know those things with more certainty, it's really hard to say it's going to be 3 months or 6 months or 2 weeks. I think it's unlikely that we're in the 2 weeks to 2 months time frame, and more like realistically starting to see things happen in 2 or 3 months. But as far as when we can realistically expect that there's a large-scale vaccination effort, it's hard to know. Dr. Calendar-Rich?
So I have to jump off, but I just want to make sure everyone knows that long-term care facilities, assisted livings have got to sign up, if they haven't yet, through the emails that they have received both from NHSN and HHS to get on the vaccine platform. The deadline is Friday. They have to sign up, or there will be no other way for them to get the vaccine when it's available for their residents and patients.
And that's an important point, because we've heard many of them have had questions about whether the email was valid or not. And so getting that message out is very important. Thanks for the reminder. Wissam, anything else you think on the vaccine front as far as timeline?
Not really. I agree with you that there's unanswered questions as far as availability for mass vaccination in a scale that will make an impact on the epidemic. Yeah, I'm guessing that's going to be till after New Year or mid next year, I would say. I mean, vaccine will likely be available before the end of the year, but to have a large-scale vaccination, it will take time.
Carla read an article where a pediatrician said COVID is a parasite. Is that true? Can you talk about this and explain that compared to a virus?
Okay.
How about it?
So biologically, COVID is a virus. And now people refer to viruses as parasites because they kind of parasitize the human cells. They enter the human cell and use the machinery of the human cell to make copies of themselves. So in a way, they are behaving as parasites, but they're viruses.
Yeah, I think that's a great point. So, there's a lot of science in the virology of replication and how that happens, and whether a virus is a DNA virus or an RNA virus, and how those things change how replication and spread inside the body happens, and then also potentially have impacts on transmission to others. And so, it's a great question because those terms do get used. But I think to your point, there's no doubt that this is a virus. It may behave in a parasitic nature.
Isaac wants to know, is there a certain range of viral load high enough to register a positive test, but low enough not to be contagious? So can I be positive and not contagious?
Yes. So there have been evaluation of the amount of virus on a swab. When you do the test, you're doing that nasopharyngeal swab. And only the PCR, that's the specific DNA test that will give you a quantity or an estimate of the quantity. And there have been a correlation between a certain amount of virus on the swab and infectivity. So if the PCR is negative, assuming all goes well, and the reason the PCR is negative because there's very little virus or no virus, that means there's no infectivity. That person is not infectious. But even if the PCR is still positive, but very low titer, again, below a certain threshold, there's also no transmissibility.
And we know that plays out in timing. So there's a time frame, really starting maybe a day or two before symptoms, where your viral load would be highest and you would be most infectious, and then that trails over time?
Correct, yeah. Infectivity is a few days before start of symptoms. Now, there's the tricky part is some people are completely asymptomatic. So where do you know, when do they start transmitting? But there is transmission even in those that are asymptomatic. But let's just talk about those who have symptoms. Then mostly the highest viral load a few days before start of symptoms, and peaking around 5 days after start of symptoms. And within 10 days, for the majority of people, they become uninfectious. And they could get out of isolation. They still keep precautions as usual.
Johnny says there are schools now quarantining exposed of exposed. I thought only exposed people need to be in quarantine. Which is it?
So, tough question without knowing the specifics. In general, from a public health perspective, only those that are exposed to a known positive, close contacts that are exposed to a known positive contact, are required to quarantine. From a school perspective, in an effort to keep classroom education an option and to prevent spread, there may be specific situations where either school districts or local county health officials are unable to tell specifically who might have had close contact, or to come up with other distinctions that are necessary to decide on exactly who might need to be quarantined. And so they may cast a wider net, if you will, in an effort to be really cautious and to prevent spread. And so I can't tell you that either of them are right or wrong, but I can envision scenarios where that might happen.
Okay, so Loretta is saying, with a rise in cases, is it safe to go see my doctor this week? Should I be worried of their possible exposures? Should I hold off on checkups and wait till there are better numbers?
So great questions in there. No doubt we are seeing a change in the number of cases in our community. But we also are very, very certain that the risk of transmission in a healthcare facility, especially where we are all so focused on infection prevention and the pillars of infection control that we've been talking about here for months now, that the risk of transmission there is extremely low, even if you come into contact with someone who might be positive, if you are wearing a mask and if that healthcare provider is wearing a mask. And that's important because the risk of not seeking care can be significantly greater than that risk of transmission in the healthcare environment. We've, as someone who's seen lots of positive patients, I think you have a really good sense of that, Dr. Al-Truni.
True, yeah. And I want to add that also telehealth is an option. We've been doing telehealth for a while, so if the provider is able to do that through a video visit, that would be great.
All right. Well, we will wrap up the question session there. Coming up tomorrow, a great opportunity at the Safe at City Market children's book. This is a book designed to teach the COVID-19, or really all of the pillars of infection prevention and control to children. Sue Patterson, the Director of Marketing and Communications at City Market, and the author, Jill Balu, will join us to share how the book came about, how it's being received in the community, and how they think the businesses and patrons are doing with the major themes in the book. Also tomorrow, media are invited to a debrief and news conference with chief medical officers from across the metropolitan area at 10:20 a.m. The chief medical officers will be updating and answering questions with local KC Metro area elected officials prior to this news conference. Media will want to join the news conference to ask questions, so watch for the advisory coming out later today. Viewers, you will be able to get this information from your local news media outlets. Please follow your favorite tomorrow for more details. Finally, remember to send us your breath cloud videos and mask photos. As the weather cools, we want to see how your masks are capturing breath clouds and help us spread the word with your images and videos that masks help in slowing the spread of the virus. So with that, Dr. Al-Truni, any final thoughts for the day?
Again, with the numbers we're seeing on the inpatient side, this is kind of expected with the number in the community. We start seeing higher hospitalization, and unfortunately mortality also goes up. So everyone out there, be careful, follow the rules we've been talking about, and let's try to get this under control.
Shauna, final thoughts from your perspective?
Thank you for having us. We're excited about this ECHO and the opportunity to talk about it today. And again, if you have a chance, call your local nursing home or skilled nursing facility and just ask them, are you a part of the ECHO? We'd love to have them join us.
Great. Thanks for being here. And I'll end with a reminder that it's important for each of us to remain vigilant and to not let our guard down. The numbers that we have seen here in the hospital this week and really in hospitals across the community, and also the numbers of new cases and hospitalizations across our state and the Midwest continue to be concerning. Our teams are here and working hard every day to make sure that we can provide the care that we need or need to be able to support our community. And we need you all to do your part as well to make sure that we're not in a situation where we are worried about being overwhelmed. So remember the pillars of infection prevention and control. Wear your mask, stay physically distant, keep your bubble small, practice good hand hygiene, and be sure to be safe out there. Take care. Have a good day.